Hello everybody, and this is another Ask Dr. Bob, and we have some very interesting questions, and I'm hoping that I'm able to answer each and every one of everybody that's been sending in so many of them. Very interesting. Here's one for you. Can I take psyllium husk at the same time I take my supplements in green powder, or does the fiber bind and reduce the effectiveness? That's an excellent question, and I would tell you that it more than likely has the potential to reduce the effectiveness of your product and your protocols. Do you want to know what? We don't even promote psyllium per se. Now, I'm not saying we don't ever have patients take psyllium. Flax powder would be better. Flax powder doesn't seem to take all the moisture out of your colon. So psyllium, probably better than doing absolutely no fiber at all. Flax powder, 1 scoop. I know we have it on our website. Comes from Omega Nutrition. Next question, and I love this question. Is Pellegrino or Perrier bad for us? So I did some research on this. Perrier has larger gas bubbles. The bubbles, or the information or the product or the state that causes the bubble, is carbonic acid. Anytime that you have an acid, chances are that you might have some potential. Now, I'm not going to tell you not to take and use San Pellegrino or Perrier. I actually use both of them. I also use LaCroix. The carbonic acid may or may not cause an issue in your body. I don't know, but I do not have an acid pH in my body. Water tends to be neutral. A little bit on the acid side. I also use reverse osmosis water. That's one of the reasons that I use green food, Celtic sea salt, to help improve and naturalize the pH of my body. I don't promote alkalized water. I prefer San Pellegrino. I like the smaller bubbles. So I just thought I would throw that out to you. I thought that was quite an interesting question, and I thank you for that. Is dried organic wheatgrass powder beneficial? I don't know why it would not be beneficial, because it's a green. It's organic. It's going to be putting chlorophyll inside of your body. I'm not sure what you're going to be mixing it with, but it definitely would be. I would much rather have you use that than a pastry, so go for the green organic powder, dried, tremendous. There must be a gentleman by the name of Brian Clement who came out with a book on the toxicity of fish oil, and this person was wondering what's Dr. Bob's position on this. Well, I want you to know that we primarily use Biotics Research products in our practice. Now, I'm not saying other products are not good, but last year, 2011, I believe it was, in January of that year, it could have been 2010, I remember reading some information, and I know that the government was having an issue with many of the larger companies that were finding toxins in their fish oil. So the oil that I use is an anchovy, sardine-based oil. Small fish, less toxic potential. We don't promote tuna, we don't promote larger fish, I don't promote much salmon. I'm going to tell you right now, if you're going to even eat salmon, you want to make sure you know where that salmon is coming from. And the best way is to go fishing for the salmon yourself someplace, because even the supposedly ocean salmon today, they could get farm-raised salmon and raise it in the ocean. We do not promote farm-raised fish. I know Dr. Bob doesn't like vitamin E or synthetic vitamin E. You know, we don't promote synthetic vitamin E. And can you tell what and how it's labeled? Well, from my experience, from what I'm gathering, most of the vitamin E in this world comes from a couple manufacturers. And I know I've heard the name Kodak thrown out a lot. I have no idea why Kodak would be a part of it. Once again, I'm going to go back to Biotics Research Corporation. I feel comfortable and confident that the oil that they use is an excellent oil. We have had no side effects or no bad effects with it. But I can tell you what we really use in our practice is the emulsion forte, which is actually a vitamin E drop that you put on their tongue. I happen to use D-emulsion forte, and I happen to use A-emulsion. So if you're going to use vitamin E at all, I would go with the Biotics emulsion forte. So that was a good question. So let's talk about some other ones that we have. Question about fibromyalgia. Any ideas on how to cope with the fatigue and pain? And I just can't work. Well, I want you to know this about fibromyalgia. It's actually oftentimes caused by sugar. Sugar stresses the adrenal glands. The adrenal glands make natural cortisone. I also want you to know that fibromyalgia is very common in women over 40 years old that have and like citrus. Their bodies tend to be alkaline. Alkaline is like baking soda. So get some nitrazine paper. You could Google nitrazine paper. You can get the nitrazine paper from our website, Drugless. You can contact us. We'll make sure that you get some. You take your pH of your body first thing in the morning when you wake up. You're laying in bed. You have some of the nitrazine paper to the side of your nightstand, and you put it in your mouth. And if you're alkaline, you might not die of cancer, but you're going to have some fibromyalgia. It's going to be citrus-based. Citrus can cause fibromyalgia, so can sugar. Sugar is devastating. I have had radioactive iodine treatment when I had a hyperthyroid. Now I have a low thyroid. I'm currently on Synthroid medication. I can tell you from my experience, the thyroid gland is one of the most challenging glands to help and to work with. I know, and even in my own personal practice, we have patients that come in, they have a lot of stress, the thyroid is depleted. So, you know, your emotions have a lot to do and impact your thyroid gland. The adrenal glands and the thyroid gland work together. The adrenal gland is the fuel pump, and the thyroid is the gas pedal. So I know from our experience that when people have adrenal gland stress, they're going to have thyroid distress also. I also want you to know that 72% of you watching me right now have a lack of iodine in their body. Bromine, fluorine, and chlorine deplete the body of iodine, and your body needs iodine. So I actually have come to the conclusion for some of our patients we need L-tyrosine, essential fatty acids, zinc. There's a product that we use called Thyroid. You have the conversion of T4 to T3. We use a product called Medistim. I'd encourage you to get Dr. Bob's Drugless Guide to Balancing Female Hormones. The thyroid is a very big challenge. Synthroid is T4. It needs to be converted to T3. And menopausal women, if they're on Synthroid, have a greater chance to get osteoporosis. I think it'd be really good for you to go back and review this, go through the Get to Know videos, Google Dr. Bob DeMaria, look for thyroid answers. Last question, a desmoid tumor. A desmoid tumor is a fibroblast tumor. Fibroblast happens to be a cell that is a growth-related cell in the body. It's kind of interesting because there's a lot of information about tumors out there right now. I'm going to talk to you from my experience. I see tumors, especially in women who have excessive estrogen. Fibroblasts promote growth. Estrogen promotes growth. So I think that we have so much toxic exposure to that, number one. So depending on what's going on in your body, what you're exposed to, I also want you to know that we tend to see a lot more cysts and fibroids and other challenges in individuals who may have parasites. I'm not saying parasites cause tumor. I'm just telling you what we see from some of our experience. You could have a CBC with a differential, and that would tell me if you have an eosinophil, which is a type of a blood cell that tells me if you have growth or a sensitivity going on inside your body. These were great questions, and we appreciate these questions, especially during this busy holiday season. Send them to us, email them, tweet them to us. We're here to make a difference for you. Bye.